Hi, I'm Emilee Clark, and this is my nursing capstone project. Here is my ID. You know it's me. And I'm going to go through what I did for my project. Okay, so I created a perinatal bereavement nursing toolkit. Um, so I was hoping that this toolkit would support nurses when they care for perinatal loss families, when they have a fetal demise. And it would help improve nursing confidence and patient care quality. So I saw this opportunity to make this toolkit because when I had my first fetal demise, I felt like I had no idea what I was doing. There's so much paperwork involved. We do a lot of keepsakes. We have to coordinate with the funeral homes and mortuaries and morgue and just all of these things that we don't normally deal with. So I wanted to make this toolkit to make it a little bit more seamless. Um, and I just felt like the families that have a nurse caring for them, if they're confused, they don't know what's happening, I just feel like that's harder for the families when they're trying to deal with this loss of a baby and then their nurse doesn't feel confident in what they're doing or telling them. So um, I wanted to just help the nurses out and help improve the patient care quality as well. And then I was hoping that the unit would have improved consistency for bereavement care, increased confidence, reduce emotional strain, enhance communication skills, and for the patients, provide better care, more compassion, and provide culturally sensitive care as well. Okay, so when I was selecting my preceptor, we do actually have a bereavement team on our unit, but they kind of help with the family side of things. They send cards out to the families, they keep in touch, they help like coordinate the care with the funeral homes and things like that. So I wanted to kind of help with the nursing side. But my preceptor is one of the bereavement care coordinators, um, and she works on my unit, and she's great, and I really loved working with her and was glad that she was my preceptor. Okay, so for the purpose of my project, I wanted to create a resource that improves the quality and consistency of our bereavement care. And then for the goals, I wanted to create evidence-based resources for bereavement care, improve nurse confidence in providing perinatal loss support, and then address mental health needs for the nurses that care for the loss. I know it's affected nurses when they've had like multiple demises in a row. I've also had a nurse tell me that she was trying for a baby um, and ended up having a demise during that time, and it was just really hard, like emotionally. And so I wanted to create mental health resources for our nurses as well. Um, just a sheet where they can find the resources that we have if they are struggling when they have a demise, um, so they can get the support they need. Okay, for my toolkit, I created 4 different documents. The first is a frequently asked question document, religious considerations, mental health resources for nurses, and a communication script. So this is the first 2 pages of the frequently asked questions document. I just included all of the questions I could think of. I also asked all of my coworkers, the things that they struggle with, and compiled it into a document. I pulled a lot of this information from our bereavement policies. I honestly didn't even know we had those, so I just feel like when you're caring for a perinatal loss and you also have other patients, you just don't have time to like go to the computer or try and find the policy, even if you're lucky to find it. Dig through it, find the question, find the answer. So I compiled everything into this one document, and I'm sure I'll keep adding on to it. And then here's the other 2 pages for the document. And then this one is the communication script. So I just feel like when you're caring for these families, it's really intimidating. You don't want to say the wrong thing. You want to be there to support, but you don't want to pry. And I just felt like if I included things to like start a conversation or things to say, it might help out the nurses. So there's just a few different sections on like creating space to talk about their baby, providing spiritual support, emotional support, encouraging the parents to express their feelings, just a guide on how to get a conversation going. And then this is the religious considerations. So I researched the most popular religions in Utah and compiled them together, and then did research on their like funeral customs, and then if they differ with like an infant, and just put them in bullet points on like the main things nurses might need to know. And then this one is the mental health resources for nurses. I did some research on specific like mental health resources for healthcare workers, and so we have a Utah crisis line, and then our employee assistance program. They can provide therapy and support that's covered through our hospital. And then Safe Utah Frontline is actually a pretty cool app that's designed for healthcare workers. And you can talk to a licensed counselor through the app. You can text them or call them. And they are trained counselors from the Huntsman Mental Health Institute. And they can provide more support for healthcare workers. And then the Utah Warm Line provides peer support for emotional distress. So I wanted to give our nurses some resources when caring for these patients. You never know when it can bring up difficult feelings, and I wanted our nurses to have access to help if they need it. Okay, so the analysis of my project, it took place on our women's special care unit. All of our nurses work between women's special care and maternal newborn, but we do have them separated for situations just like this, so our demises aren't right next to a room that has another baby, and then they can hear that baby crying. So we like to keep them separated, and really keep them in mind. And then adjustments to my project, I did extend the timeline to gather more resources. I had to do a lot of research, especially with the religious considerations and trying to find the mental health resources. And then I did include more information on the fact sheet from my preceptor feedback. And then some challenges were finding the religious considerations. It was just hard to make sure the source was reliable, and I really didn't want to put anything on there that was not correct. And then some other difficulties was trying to align my schedule with my mentor, and trying to get paperwork signed and stuff like that. And then for collaboration, I had regular meetings with my mentor to get feedback and just have a look through the documents. And then I did actually make a Facebook post. Our work has like a group Facebook where we trade schedules and stuff like that, but I made a post where people could submit questions for the document and just any questions about bereavement. And so it was great to get feedback from my coworkers. Okay, so to assess my project, I created a pre and post survey. So I surveyed 45 nurses on my unit. So for the pre-survey, I asked them their confidence level on caring for a perinatal loss. And as you can see, most people were on the lower side of the scale. And then I had them look through the papers and assess them again, ask them their confidence level on caring for a perinatal loss, and as you can see, most people were on the higher side, with most people saying 5 out of 5, which I think is pretty good. For my project evaluation, I was happy that I achieved all of my goals and I was able to complete all of the documents that I wanted to. And I was really happy with the positive feedback I got from my coworkers. And then I do feel like this will benefit the unit and reduce stress and increase confidence when nurses are caring for perinatal loss families. I do feel like I was able to strengthen my leadership skills and my research skills. And then with my leadership evaluation, I do feel like I was able to take initiative in the project planning, resource development, and I adapted well when there was feedback and challenges with my project. Okay, for my conclusion, I was able to complete my comprehensive toolkit, and I really hope this supports nurses in the future. And for my future impact, I hope I continue with nursing education and being in a leadership role, because I do really enjoy that, and hopefully moving on to my NP, I'll be able to bring what I've learned into my schooling and my career. Thank you for your time on watching my PowerPoint. And yeah, that's it.